As part of the Affordable Care Act, most health insurance programs must now offer services to women in 8 areas without requiring copays or deductibles. The services include domestic violence and HIV screenings and human papillomavirus testing. Some churches and hospitals are exempt from the requirement to provide access to birth control. Meantime, Governor Mary Fallin is putting off a decision on expanding eligibility for Medicaid under the act. And state leaders have also decided to wait until after the November election to create a state health care insurance exchange. All this comes as communities look for ways to meet the needs of an estimated 700,000 Oklahomans who have no health care insurance.
Governor Fallin has declared the week of August 5th Health Center Week to raise awareness of the services those centers provide to Oklahomans, many of whom have no way to pay for the health care they receive.
40% of the patients that were seen at the health centers in calendar year 11 were uninsured, and 30% were enrolled in Medicaid, an astounding number.
Because of funding provided by the Patient Protection and Affordable Care Act, 6 more community health care centers will be open in Oklahoma by the end of this year, bringing to nearly 50 the number of sites in 30 counties. Last year, the centers had 400,000 patient visits. Oklahoma is ranked 48th in national health rankings, 49th for primary care physicians. In the last decade, Oklahoma obesity rates have gone from nearly 20% to more than 30%. And while smoking rates have declined, the state still ranks 3rd from the last, with nearly 1/4 of the population addicted to tobacco. With an estimated 700,000 people without health care insurance, even with 6 new community health centers, there are not enough to provide the health care the growing population of Oklahomans in poverty actually need. For decades, church groups have tried to fill that gap. The Baptist Mission Center in the Stockyards section of Oklahoma City was founded just after the turn of the 20th century. Since the 1970s, the Capital Baptist Association has provided primary health care, food, clothing, medications, and a long list of other services to anyone who could make it to their front door. The center is now open 3 days a week and sees about 50 patients each week.
Last month, we didn't have one patient from the month before. Everyone was a new patient. And that was really alarming.
Marcus Gentry is Assistant Coordinator for Community Ministries. He oversees daily operations of the Baptist Mission Center. It is an all-volunteer staff, including the doctors and nurses who give their time in the small examining rooms to help those who need health care but can't afford it. Dr. Jeff Hoover gives his time to the Lighthouse Medical Clinic, which is just a few blocks away from the Baptist Mission. Again, with a staff of volunteers, the center, sponsored by a Church of Christ congregation, does what it can to fill the health care gap.
Many of whom are not documented legally. A lot of Hispanic folks that don't know English, and just a variety of folks from around the community that can't pay for health care.
Both men say their efforts have improved in recent years, largely because of partnerships that have formed out of necessity.
We've been able to form a relationship with a lot of the other free clinics around there as well. And what we can't offer, there's other clinics that can, and vice versa, you know. And it's grown and evolved over the last several years to just see more and more people and be able to provide more things and try to fill in the gaps.
We have started a new association with the clinical research here in Oklahoma City, and they have allowed me to send people that are falling through the cracks. Our system is overloaded. Our mental health system in Oklahoma is overloaded.
Through the Healthcare Alliance for the Uninsured, we've been able to get folks care that needed it. For instance, with either heart disease that needed expensive procedures done. We have a couple of gentlemen with cancer that are being treated.
Donations from church members help buy the medicines the facilities both need. Hospitals and clinics also donate equipment like the new EKG machine at the Baptist Mission. But every day these clinics are in operation, they face the prospect of having to turn someone away.
I can tell you what happens. Over 50% of those folks are going to end up in jail that day or within a day or two, because they were out of their meds. But you have to have a cutoff. I mean, there's days when we could take care of 25 patients, but we only have 1 doctor and 2 nurses.
I think we do as good a job as we can caring for the uninsured. The problem is we have too many uninsured.
There is speculation that even with the new federal requirement that eventually everyone has to have health care insurance, many Oklahomans will just ignore it, much like about 30% of Oklahoma drivers already ignore requirements for minimum liability car insurance. Dr. Hoover says no matter what law is passed, access to quality health care in Oklahoma will not change very much until something else changes first.
We have to decide as a state what we're going to do philosophically with the uninsured. And I think that it becomes a question of, is health care a privilege or a right? And I think in Oklahoma we still believe it's a privilege, and I don't think anything's going to change until that mindset changes.
The clinics run by churches are also seeing a growing number of new clients who actually have health care insurance.
Because there are some people that have insurance, but the insurance is not adequate to take care of their medical needs and their medication. By the time they get through with the co-pays of the test, the doctors, there's nothing left for medication.
And then there are those who have done the math, looked at their health, and decided to take a chance.
I see plenty of people in my clinic here in Edmond, Oklahoma, who don't have health insurance. And it's because of a choice they made to do that. And it's a little bit of a gamble.
With the help of volunteers, from someone to answer the phone to a doctor or nurse caring for a patient, the church-run clinics are getting better at helping Oklahomans who need health care but can't pay for it. But they also know, somewhere in the state every day, there are people suffering because there was no access to simple, basic health care.